Hi.
Nice to meet you. I'm Megan Long. I'm with Ireland. How are you?
Nice to meet you. I'm Julie. I'm good.
How are you doing today?
I'm doing okay.
Good.
Doing okay.
Good. So basically, what I kind of want to talk to you about is we're kind of going to go over that you're currently involved with DCS. So we're going to go over the referral that the case manager sent to us. We're going to kind of go over the goals that they have listed and kind of talk to you about what they want you to accomplish and what you kind of need to do for them. And then we're also going to kind of talk about what other goals you might have yourself. So anything that you would like to work on, while we're working together, we'll kind of identify and go over some of that as well. So one of the other things too I kind of want to talk to you about is confidentiality. So obviously, what we say is going to be between us. The case manager does have access to, documentation and notes, but it is going to be, basically anything that, really the only thing that they're going to know is anything that's really pertinent to the case. So anything that, and if anything, is harmful and kind of threats against yourself, somebody else, or anything that would negatively be impacting your case. For example, if you would tell me that you had started experimenting with drugs. Those are all things that we do kind of have to report because of the fact that you are involved with the system. However, if there's anything that you're going through, certain things that you're feeling, that kind of stuff is going to remain between just us. So if you wouldn't mind kind of giving me some background info. I don't really have a lot of info kind of about how you got involved. So if you wouldn't mind telling me a little bit more about your side of the story, that would be okay. I would appreciate it.
Well, I just very recently got out of jail. I've been there for a few months because I was arrested for possession of meth.
Okay.
I had been suffering from addiction since I was about 18.
Okay.
And then whenever I was arrested, they removed my son from me. He's 2.
It's going to be hard, I'm sure.
Yeah, I miss him a lot. But I've worked really hard ever since then to kind of clean up my act. I've been clean ever since.
That's great.
I'm in drug counseling now.
Okay.
I'm still working on myself, but I'm in a really good place right now. I feel better than I have in a very, very long time, and I'm willing to do whatever it takes to get my son back.
That's wonderful. That's wonderful. I think it's so great that you seem to kind of have this sense of motivation and drive to really kind of want to do what you got to do to get him back, and that's really the most important thing. I think a lot of times people come into this and it is hard. It's not something that's easy, and I think trying to really make the best of the situation is really the way to go, and it seems like you're really in a position to do what you need to do to be able to get him home, and I think that that's great, and it's really going to kind of make this whole process easier, and that's kind of what my job is, to try to help you through this and make this process as easy as possible, and get you to a point where you can take care of yourself and him to the best of your ability. So a couple of the things that are goals that we're on this referral to work on is employment and income-based housing. So as far as employment goes, do you have any type of work history at all?
No, I've never held a job before.
Okay. Is there any type of area or any interest that you have thought about potentially working in?
Well, I really like working with people. I really enjoy being around people. So, I don't know, maybe waitressing, something like that.
Okay, I think that would be a really great place to start. I think not having a lot of work history,
Right.
I think a lot of times that can really be a good field to kind of go into. And I think, especially since you like people, you're going to be working with them all the time. So I think it's really great, kind of being able to recognize what skills you have. And I think waitressing would really be a great kind of career to apply those skills. So I think we can definitely, kind of explore that and look into that some more.
Mm-hmm.
And then the other thing was the income-based housing. I know right now you're kind of currently staying with a friend. So, housing's a big thing. But obviously, to be able to get housing, you kind of need to have some income coming in.
Right.
Kind of makes it difficult.
It makes it really hard.
Yeah, if you don't have any income, you can't, really get a place. So, it's kind of a one step at a time process.
Right.
But, like I said, we'll get through it. We'll get it done. So there are some, there are several income-based housing areas, complexes in the area. And so we can kind of explore those. It's kind of good to try to get those in as soon as possible, honestly, because there are waiting lists. So the nice thing with that is that, you don't really 100% have to wait for a job for those, because even if you're making minimum wage, like I said, they only do a percentage of your income, and because the waiting list is long, while you've got those in and you're waiting, you can also be searching for a job. So you can kind of do both of those, kind of at the same time. But the most important thing right now is really kind of getting some employment and getting some income coming in. And if you're able to do that, we can look at potentially exploring other housing that's not income based. And a lot of times the waiting lists for those are a lot less. So if you have income, it kind of really opens the possibilities for you.
It helps a lot.
It does. And, we really want to try to, help you to, in any way that, we really can and get your son home. I know that's your main goal. So in addition to kind of those two goals that they had laid out, is there anything, personally that's not listed that, you would like to work on, that you would like me to try to help you while we're going to be working together?
Well, basically because of my addiction, I was not able to finish high school.
Okay.
So I'm really interested in seeing what I need to do about getting my GED.
Okay.
Because I feel like that would help me a lot in terms of finding a good job. Because I know that, waitressing is good, but, to take care of my son, it might take a little bit more than that.
Right.
Especially later on. And I feel like it would help me to do what's best for him.
Okay, I think that's great, and that's, I think it's a really great goal to have, and it's something we can definitely work on, getting hooked up with some GED classes and some training, I know sometimes, when it's been a while since you've been in school, and so it's kind of good to have that, have that refresher, but, and, taking some of those classes and getting you to take the test, and, and that right there is going to, like I said, it's going to open up more doors for you in the future, and that's going to be, a really big help as far as jobs, and, and if you find out that, you want to do something, you're great with people, so, there's lots of jobs that work with people, and so, maybe looking into, if you wanted to go to schooling later on, go to college, having your GED is going to be able to open those doors for you, you feel like that's something, that you would, be potentially interested in, in the future, and exploring that.
Yes,
okay.
Yeah.
And I think that's something we can talk about, and they'll kind of go over that with you too, when, is kind of, furthering your education even from that, but getting that is a really, really great start. So as far as next time, I think definitely we can make a point to actually go out and search for some jobs and put in some apps, try to get your job as soon as possible. So if you want to, maybe yourself, and from now to the next time we meet, maybe kind of jot down a list of some places that you might be interested in working at, or any places that you know of that are hiring or that you might enjoy, and I'll kind of rack my brain too, and we can get together and try to hit as many of those as possible. You think that would be something that you could do for the next time?
Yeah, absolutely.
Okay, that sounds great. Well, that's all the time we have for today, but I will plan to look at my schedule and give you a call, and we will meet sometime next week. Does that sound good?
Sounds great.
Okay, great. It was so nice meeting you.
You
Thank
too.
you for coming in, and I will see you next week.
Thank you so
all right.
much.
Thank you.